to another live surgical skills clinic on YouTube. Last week we were covering all things tendon repairs, and we've got another live session coming up this month. Just head to the website medsingltd.com/events to sign up. We've also got our members area on there, which includes being a member on here, all for the same price as being a member on here, but we give away far more content and resources for aspiring surgeons, including PDF textbooks, live training, one-to-one training, all for the same price as being a member of this channel. Today's surgical skills clinic is going to be on two important things. Number one, the deep dermal suture. Number two, the subcuticular suture. Both are hidden sutures, really good for elective surgery. Both not always done very well. So I'm going to be covering these two techniques. First of all, we have to make a wound. So you have the precision grip and then you have the power grip. For skin incision, for small wounds when you're cutting out wound edges, etc., you just want to hold the knife. I don't say like a pen because people hold pens in different ways these days. You have a look at how people hold pens, there's all kinds of ways. The way you want to hold the knife for a precision grip is between your thumb and index, middle finger somewhere nearby, little finger for stability. Put some counter traction between your fingers like here, so not in line with your fingers, but perpendicular to where you want to cut. Your fingers applying traction either side. Pressure on the blade body, not just the tip. This is the tip, this is the blade body. Let's do a little zoom, boom, to really capture the view. And we're going to make that first incision. See that nice neat opening? Rather than just keeping my fingers here, move my fingers along and continue the cut. If you're not in the depth you want to be, you can make your next cut in the same distance. And there we go. You can see the fat pop up just there. So today we're covering the deep dermal and the subcuticular, the two hidden sutures. Just talked about how to make a precision incision. Hold it between index and thumb, middle finger somewhere nearby. Make your incision. Fingers are perpendicular to where you're cutting, not in line, that's dangerous. Fingers are perpendicular. Make that cut and go straight down. So we're going to start with the deep dermal and then the subcuticular. Don't forget our next episode or session, which is straight after this at past, will be microsurgery techniques with this MedSync microsurgery simulator. So do tap in for that. But let's get on with this. So your deep dermals and subcuticulars, typically you want to use a dissolvable suture, one that will last a while. So something monofilament or braided. So you classify sutures, dissolvable, not non-dissolvable. So this is a braided suture. I think the equivalent is like Vicryl, which is commonly used, but Novosin is another brand. Or PDS, monofilament braided. Pick whichever one you want. But typically you would use the undyed suture because it's going in the dermis. You don't want to see the suture under the skin. So I'm going to go with this braided suture. Peel the packet. I can see my needle right here. So I'm going to mount it with this MedSync needle holder, like so, and pull the packet away, don't pull the needle away. I'm using a dyed suture here so that you can see what I'm doing on this skin pad. Mount the needle body 2/3 from the point to the tip, from the tip to the swage. So swage is where the suture thread attaches, the point is where it does all the penetrating through the skin. So when you start with your deep dermal, reflect the skin back. You have so we have two layers of the skin. This pad shows it really nicely. I'm not going to tell you where it's from though because I'm not endorsed by this company. So they don't pay me, so therefore I'm not going to promote them. So epidermis and dermis. The dermis in patients in real life is white, no matter their ethnic background. The dermis is always white. You don't want to stitch the epidermis, you want to just stitch the dermis. You don't want to stitch fat, which is, you can see at the base there. So you go from deep to superficial on the side closest to you, and superficial to deep on the side away from you. This is what we do in real life for wounds that you want to keep closed. So deep to superficial. I'm going to do one zoomed in, and then one zoomed out so you can see my hand positioning. Mount it straight away, and then pull. And then we're going to go superficial to deep on the opposite side. Again, I'm going to do this one zoomed in so you can see what I'm doing. And then I will zoom out so you can see what my hands are doing. Don't get caught in the loop. Put it through. And then notice two things. My forceps are palmed, and then my short end is not that long. Wrap it always how you do your surgeon's knot, then your reef knot. So if you push the suture forward, it makes a loop. I'll zoom out a little bit for you. Wrap twice around the tip, 1, 2, and with the deep dermals you tie it parallel, not perpendicular. And we go again. It's a reef knot, and then another reef knot. My scissors have disappeared, so I'm going to cut with the blade. And then you get opposed edges like so. It's a bit overriding, but I can correct that. So now I'm going to zoom out and let you see what my hands are doing. If you're getting value out of this, like the feed, share the feed with colleagues and friends. This is really essential if you're an aspiring surgeon, medical students, or working, you just need to suture. Your suture needs improvement. So I'm in the normal mounted grip, deep to superficial. Pull the suture through. Leave a short end, not too short, but leave a short end. And then we go from superficial to deep, but I go to the palm grip for this side. Take a good bite. That wasn't a good bite. It's a deep bite, but I like where it's placed, so I want to just continue that. Follow the curve, pull it through, don't get caught on the operating table, etc. Got to find our short end, which is inside here. And then pull this. There's no rush, just take your time. Surgeon's knot, which is 2 revolutions. 1, 2. And then another one. And then another one. My forceps are always palmed in my hand, so they're always ready to go. And cut. You can palm your scissors if you so desire, like this. I'm going to do one more in the middle, and then we're going to do the subcuticular to follow. So we go from deep to superficial, but here's another trick for you. Don't go vertical, go oblique. So not horizontal, not completely transverse like this, but go from deep to superficial, go obliquely so you get more excursion through the tissues. Push it through, grab it straight away. I'm grabbing the body, not the tip. Follow the curve. Mount it straight away, and then I palm it. And then we got the other side, like so. Don't come out through the epidermis, you just want to stay in the dermis, but you want to get a good distance of bite so that it's got good purchase and doesn't just rip out, especially with a braided suture. Braided sutures don't rip out as easily because they have more friction due to the braids. And you can feel that when you pull your suture. Just need to find our short end, which is somewhere in here. It's just there. Okay, and then as you can see, we tie it parallel to the wound, not perpendicularly. Put it perpendicular, it will open. We don't want it to open, we want it to stay closed. So 1, 2, a surgeon's knot. And then your reef knot. And then your reef knot. Alternating their positions. My scissors are still in my palm. I flick them out. I cut it. So now we need to do the subcuticular. Now, that was a braided suture. I'm now going to switch to a monofilament suture. I'm going to switch to the PDS. Actually, I'm going to use another braided suture. It's a Vicryl, but it's undyed. I'm picking this suture because it's got a longer needle, and I'll zoom in so you can see it better. It's easier when you want to do the excursion. So, to start with, I don't do, typically people would do a bite this side, and tie a knot. When the edges are well opposed, because you've done some deep dermal beforehand, you don't need to do that. You can if you want to, but I typically will just do my deep to superficial bite, and then just tie my knot with this. So 1, 2, just to anchor it. My finger pushes it, and then you cut this one. So when a surgeon puts one suture up, you cut the one. If you put two up, you cut both. Hidden language. If you're getting value out of this, like the feed, share it with friends. Leave a comment. If you really want to get the value, join our members area on our website, medsyncltd.com/resources. It covers the YouTube lives, but also gives you clinical cases to work through, discounts to courses, live one-to-one training. It's great for aspiring surgeons. So then I take horizontal bites in the dermis as superficial as possible. Just caught on some skin here, and I pull it parallel to the wound. I tend to do the first one in a similar way because often there's a gap at the beginning. Push it through, grab the body straight away, mount it straight away, and pull. And pull, and pull. So we're here, and you go in opposite where you came out. So I've come out here, so my next bite is directly opposite. Again, as superficial as possible. I'll zoom out in a second so you can see what my hands are doing. As superficial as possible without coming out through the epidermis on top. Mount it straight away, and pull. Pull, 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 pull. And go in opposite where you came out, as I said. So I'm here, I'm going to go in opposite right here, and then after this I'll show you what my hands are doing to get the excursion. So I'm going all the way around here and curving it till I come out at the front. but my hands are in different positions, and I'll show you what they are. And as you can see, I pull the suture parallel to the wound in the direction that the skin is moving. I'll just show you what my fingers are doing. So for the far side, away from me, I tend to palm it. I angle it like this and go in opposite where I came out, counter traction, and then I rotate it. So it's like this, and then I flex my wrist. As I'm here, my thumb goes in, my ring finger goes in, and then I continue. What you don't want to do is have to bring your other hand in to hold your forceps, to hold your needle holder, and then grab it. That's not very slick. So you just want to make sure that you can do that without. And then when I do this side, my fingers are mounted within the needle holder. As you can see, you just have to be flexible with how you hold it. And if you want to learn how to be flexible, have a look at our videos on palming the needle holder, mounting the fingers in the needle holder, and cutting left-handed with scissors if you're a lefty. If you're getting value, like, subscribe, become a member, watch our members only lives. After this session, we're doing a live session on microvascular surgery. We're going to stitch a simulated vessel by MedSync, because that's all part of surgical skills and training. You need to practice these things in simulation if you want to get better. So this is the subcuticular suture. It's buried. I'll show you how to correct these step deformities. They occur because I haven't taken even bites on both sides, but it's easily corrected with a quickly dissolving suture like Vicryl Rapide. But we're coming up to the point which is really, really important, which is anchoring or burying your knot. And there's a specific technique for doing that, which is used amongst all surgical specialties, and you must know how to do it. It's called the Aberdeen knot, at least in the UK it is. It's great that you've been a member. Make sure you join our next live session. Hopefully you've been getting value out of it. If there's anything specifically that you want us to cover, we will. Yeah, you can. So what you want to do is actually become a member on our website, medsyncltd.com/resources. We're about to upload a load of videos for plastic surgery residents. They won't be on here because YouTube doesn't allow it. So that's why we've created the same membership, but includes the YouTube stuff and our own website stuff. So we've got local flaps, fracture fixation for hands, microsurgery nerve artery, dissection for simulation. We're going to start uploading some stuff on flaps. Oh, but that's all on our website. YouTube won't allow all that stuff. So it's too graphic for here, it seems. So if you want to do that, join the website, medsyncltd.com/resources. You can cancel this one, you'll still have access to the members' content. Anyway, but you don't need both. So the Aberdeen knot, make a loop over your fingers. Bring the needle remains on this side. The loop is over here. Bring the suture with the loop on it through. That creates another loop. Pull the lower loop. I'll do 2 more and then I'll zoom in. Loop over your fingers. Suture with the needle on this side here. Pull the suture through. That makes another loop. Pull the lower suture down. 1 more. Loop over the fingers. It's bring the suture through. It's a separate subscription, but all the content that's on here is on there and more. So you can still join all the members' lives via the link we give you on the website, but it includes more resources for people interested in plastic surgery. So we make the loop over our fingers like this. The suture comes through the loop and comes in there, and then you bring it through. Yeah, so in summary, if you become a member of our website, you get all the YouTube membership website stuff, but it's the same price, and you just get more value for money. I tell everyone this, but I guess some people like YouTube a lot. But our website has far more value. medsyncltd.com/resources. It should be in the description if you have a look. We've got our members only session after this, which is on microvascular anastomosis. So you're going to want to tap in for that, Usni. Alright, so I did the Aberdeen and then took a bite on the last loop, brought the whole suture through the loop, including the needle, and then took a bite deep inside. And then you cut. Now, this is not my best work, I will have to say. In reality, I cut that out because it's not good enough. But in reality, I wouldn't do it like that because I think I'm going to blame some of this on skin pad, which is like a never thing I never do. But I'm doing it today. So the reason this is overlapping is because I haven't taken a bite on this side in the same place as I have over there. But I can correct that. Dissolvable suture, take a small bite here, take a slightly deeper bite on that side, and then suddenly I have corrected my step with a quick suture. But the purpose of the subcuticular and the deep dermal is that you don't have sutures on the outside, but sometimes you don't want to have to take everything out. So this is an easy technique to do so. If you're getting value, you're learning something, like the feed. If you're a member, stop being a member here and become a member on our website because it's better. Same cost, but regardless, as long as you're learning, it's all good. After this session, I finish this suture, we're going to switch over to our members only tutorial, which is on arterial anastomosis. You can subscribe on YouTube, or you can go to medsyncltd.com/resources and tap in there. So that was the deep dermal and the subcuticular. It's a hidden suture. You can watch this on replay on our YouTube site, and for members, you can watch our live session right now on here, or you can get the link from our website. If you're a website member on medsyncltd.com/resources, link is in the description. We'll see you next week for our next session for the Surgical Skills Clinic. Take care, bye bye.